Okay, Dr. Wyman, could you tell me what part of the medical field that you practice, your full credentials, your curricula vitae, and everything else for me?
Might take a long time.
Well, okay, how about the highlights?
I graduated from medical school from the University of Illinois.
Mm-hmm.
That was back in 1953. And then did my internship at Los Angeles County Hospital. We call it the big county. It went on the east side, not Harvard General. That's Little County. And then I did my specialty training at Cincinnati General and at the Los Angeles County Hospital, and then did a specialty training in cardiology also at USC County Hospital. Came into practice in San Pedro directly after that, which is 1959.
Wow.
And chose, I think, a perfect place to practice. At that time, there were no credentialed cardiologists anywhere. Certainly not San Pedro, but not Torrance. There was only one that was credentialed in Long Beach. So I literally had no competition. And I was able to start a tremendous program at San Pedro Hospital. And we were particularly working in the field of preventing sudden death in patients who have heart attacks. And our hospital, in fact, had the best record in the world in terms of decreased numbers of what we call ventricular fibrillation, which is sudden death after you have a heart attack. And we did it by giving a specific medication very early. And we're able to present this material all over the world. And so our hospital, San Pedro Hospital, became exceedingly well known. And I practiced until until 2002. 2002 is when I quit practice. I was very involved, and I'm still strongly connected with USC. I was clinical professor of medicine and cardiology at USC. And all this time, I was very involved in groups that were interested in providing care for everyone. And that goes back to the Physicians for Social Responsibility. I was on the opening charter group of that. That was way back in, I guess, maybe in the 60s. And then also, currently am very involved in a group called the Physicians for a National Health Program. And this is the strongest group, I think, today, working for a one-payer system. And that's what I'm particularly interested in, a one-payer system.
Now, when you walked in, and one of the first things they started talking about was how upset you are right now with President Obama and his sort of backing off on a government-funded plan.
Yes.
Can you tell me more about that?
Yes. Obama, when he was in the Senate, and I followed his career very early. When he was in the Senate, he then was for a one-payer system, and stated such. Now, with the tremendous amount of negative attitude of Democrats, for example, the Baucus proposal is a terrible one, and also, of course, from the horrible reactions he's getting from the Republicans, he's backing off from just a government option, not a one-payer system necessarily, but the government option to the program where the insurance companies would have complete control. And that's a big problem in the United States, is that the whole medical field not run by the doctors. They're run by the insurance companies and the pharmaceutical companies. So I'm worried that if he in fact gets more negative comments, which he already is getting, that he may even back off of the public option, which I think is so important. I'm not strongly in favor of the public option simply because what will happen is that the insurance companies will not take the difficult cases, and the difficult cases will then go to the government plan, and as a result the costs will be higher because of your sicker patients, and they will not be able to show the big difference that they can show if everybody was working on a level playing field.
So what do you think about their argument that if there is a government-funded program, that they will be run out of business by government?
If in fact they have...
One moment.
Yeah.
As you were saying, Dr. Wyman.
It's interesting that that big business is afraid to compete on a level playing field with the government program. If in fact the big business, the insurance companies have a better program, people will then go to the insurance program. If in fact the government has a better program, can show reduced costs, then people can choose to go to the public program. The point we have been trying to make, and I'm a strong member of this group called the Physicians for National Health program, that what we can show is that the HMOs and the insurance companies have a 30% fee or 30% cost for their just administration, where in fact Medicare has only a 5%. And so it's clear that when you get medical care and you're connected to an HMO or to an insurance company, 30 cents of the dollar goes for just administration, not your care whatsoever.
Right.
And so the fact is that if the insurance companies want to then try to bring their costs down, fine. People can then go to the insurance company. But as it stands now, the American health system is in a horrible mess. People are not getting treated, and they're not able to buy the medications because prices are so high from the pharmaceutical companies. And as a result, people go without medicine. They do not see their doctors. We have approximately 50 million people with no health insurance whatsoever, and another 20 or 30% who have a very deficient plan as well. So in fact, a national program can provide care if they have a one-payer system and provide it cheaper and more effectively than what we're getting today.
Awesome. What do you think about their complaints about the government trying to create a board, I would imagine physicians, in order to sort of govern any sort of public health plan?